What is the IDEA4RC Common Data Model?
We have started designing the IDEA4RC Common Data Model. This data model will allow us to integrate the data from the different centers of excellence that take part in the project. And we are structuring the data model into two big areas, the data of the project and the metadata of the project. With the data, we are describing the medical, clinical knowledge of the project for the rare cancers. We are working specifically in two types of cancers, head and neck cancer and sarcomas. Right now we are working on sarcomas. And with the metadata, what we are trying to do is create a description of that data that is going to allow us to follow the FAIR principles. We want our data to be findable, we want our data to be accessible, we want our data to be reusable, and we want to create an expressive common data model that will help us use that data.
How are you going to build the common data model?
In order to create our common data model, what we are doing is we are working with the clinicians. We have received from the clinicians, extracted from Neuracan, the most relevant variables that we need to include in our model. And we are also taking into account the different existing standards to model the data. We are currently considering two standards, FAIR and OMOP. And what we intend to do in our project is combine both of them. We want to use both of them to support as many centers as possible.
Can you tell us more about metadata and how they help to follow the FAIR guiding principles for scientific data?
When we were designing the metadata for our model, we took into account three different categories: data quality, data findability, and governance. For data quality, what we are doing is creating some metrics that we can apply to our data to see how good is the data, how usable is the data, how complete it is, how aligned it is with the reality, if it is the data that we are expecting. So when someone is trying to create, when a researcher is trying to create the cohort to do their research, they can see the quality of the data of that cohort and decide if it is useful for them or not. Then with the governance part of the metadata, what we are doing is we are creating the methods that we are going to use to say who can access that data and how they can access that data. Because as our infrastructure is a federated infrastructure, and the cohorts that the researchers are able to find using our infrastructure are going to be composed by the patients in the different centers. Each center is going to have a different policy regarding governance and how their data can be reused and how their data can be accessed. It's important that we annotate all the data in our system with that governance metadata. And finally, the findability metadata is what is going to help us to find the data that the researchers want. It's what is going to help us to find those cohorts that we want to create.
In what phase of the user journey will the metadata be exploited?
The metadata is going to be used for the discovery of the data, but also for when the researcher wants to use that data. Once we have told the researcher, yeah, that is the data that you want, the metadata is going to tell them how they can use the data. What is the process that they need to follow to be able to access that data? What are the documents that they need to present to access that data? How they can use it? Which variables they are able to access? And perhaps there are other variables that they cannot be shared with them, depending also on where the researcher is. If it's within Europe, I think that it's going to be easier. And researchers from a country outside of Europe probably will have additional restrictions. So that's what the metadata is trying to guide.
Your team at the University of Deusto, together with researchers at Fondazione Bruno Kessler, will develop natural language processing NLP tools for the project. What will be the first steps?
One of the big objectives of the project is that we want to use all the free text that is in the electronic health records, the text that the clinicians take by hand, and it's not structured, it's unstructured information. But there is a lot of data there. There is a lot of data there. but currently it's really hard to be able to consume and use that data because it's not structured. What we are doing is we are developing some natural language processing tools that will be able to process that free text and extract the information that is relevant from those free texts to include it in our common data model. So to do this, we have two big challenges that we need to tackle. The first one is that we have I think centers from 11 different countries with 11 different languages in the project. So we need to create tools that are able to process those 11 languages, not only English or not only Italian or not only Spanish. We need to process those 11 languages, so that's a big challenge that we hope to tackle. And the second one is that to create those natural language models, we need to train them. We need to have data, annotated data, that we use to train the models and for the models to learn. But it's very possible that this free text contains personal information. For example, Mr. Almeida, or this user that is from this location. So it's information that can be used to identify the patient. So we need to work with each center to see how they can provide us with that free text, which procedures we need to follow to be able to process that data, etc.
How will the models be used once they have been trained?
Once we have the models constructed, they will be executed in premise in each center. And the idea is not only to use it for the new patients, but they can process their whole database with all the free text that they have in the database and add that information to the common data model. This is great because we are focusing on rare cancers. So there is not much information about rare cancers because they are rare and we don't have a lot of patients. So being able to use all the information that is already stored in the common data model is super useful for us, and I think it's going to be also super useful for the researchers that are doing research in this area.